Hi, well, we're back with Dr. Rory. And this particular time, Rory, I'd like to ask you this, Doctor, is I'm 66. I'm seeing a lot of my friends coming down with illnesses. I've had a douse of cancer and I've survived that. What should we do for preventive maintenance? What should we do to keep ourselves at that level of safety?
That's a very good question, because I think it's a thing that a lot of people overlook. Probably primarily the most important part of that is having a good relationship with your own GP, and at least making sure that you're getting your warrant of fitness checks done every single year. I mean, we have to do it for our cars. I think there's way too many people who either have this false belief that, hey, look, I exercise and I eat well, I feel fine, why do I need to bother seeing a doctor? If I need something, I can go to the hospital. And I think that's an error in thinking that often bites people in the backside.
Right. So, and to do that, it's building the relationship with our doctor is one part of it. Should we be asking our doctor anything in particular, or should there be regular checks, or how often should we be seeing a doctor?
A good doctor, the questions from your side are always smart, but a good doctor has a handle on things because they have an understanding of your background. And part of that is like family history. So you think about a lot of familial conditions like ulcerative colitis, hypertension, heart attacks, cardiovascular issues, knowing at what point you become, when you're going to be at higher risk for those conditions. And then obviously as well, your yearly physical checks. So skin checks for moles, skin changes, your blood pressure, which is a really, really big one. And then obviously all the routine bloods for things like your liver functions, your renal functions, cholesterol, glucose. I can think of so many more. And then obviously for us guys, at some point, your prostate starts becoming a very big factor in your life. I think people regret or ignore those things at their own peril. A lot of those are what we call silent killers, where they're doing damage without you even knowing it. And if I could pick one specifically, hypertension. It's a word that everybody knows about, and you hear hypertension, most people think 120/80, and that's about as far as they know. But it is, if it's not controlled, if it's not found early, it can cause severe issues down the track.
So give me the symptoms for hypertension. Now, I've got a friend, it's someone actually who is very active like this, and he moves around quickly when he gets very upset very quickly, and he's like this. And I always think, oh my God, his whole body must be really jarred up and really tight for the way he sort of operates. And for myself, I must say that I don't drink coffee anymore, and I try to avoid stress.
It's a big one. Avoiding stress these days, especially the last 2 years, is not the easiest of things. But so hypertension, that refers to the pressure of the blood in your arteries. And when you go and get your blood pressure checked, you will end with two numbers. So let's give like the one I mentioned earlier, that standard number that everybody thinks about, 120/80. The higher number, let me go back a little bit. The lower number. So if you think back to high school science, if a liquid is in a container, that liquid exerts pressure on the container. And in this case, the liquid is your blood and the container is your blood vessels. The lower number is the pressure in your vessels at rest. The higher number, obviously, is the pressure in your vessels when your heart is pumping and actively forcing it through. So, for most of us, anywhere from 60 to 90 beats a minute, that's forcing its way through. And the issue with high blood pressure is, maybe we step back a second. So when do you have high blood pressure? Technically, from our point of view, it's sustained readings of above 140 on the upper limit and above 90, either or, above 90 at the bottom or above 140. So often we'll get patients who come in and their blood pressure is up, but you don't really make that diagnosis just then unless it's massively elevated. So if they're coming in there with, say, 210/100, that's not going to be high just because they've had a rough day or 2 cups of coffee. But invariably, if it's kind of in the iffy range, so 150/95 or thereabouts, you'd be rechecking them at regular intervals. So making sure that they haven't smoked before they're checking, that they haven't just run into the clinic for that. And if it remains elevated, well, then that leads to another couple of decisions. Is it something that we're going to try first to deal with dietary changes. So sugar content, salt content, all those other things. The other lifestyle factors, stress is obviously, as you've mentioned, a very big one, because that the underlying adrenaline, cortisol, that has an effect on things as well. Or is it one where medication comes in? And that's a whole topic on its own. There's so many different types of medication and ways to deal with it. Yeah, how about yourself? Have you come across that in your own life, or?
Oh, yeah. Well, no, my blood pressure has always been very good, so I've got no problems with that at all. But I certainly have fibrillation issues where I'm on medication for that. And also, I know that by reducing coffee, I can tell you now, Rory, I enjoy alcohol, but as soon as I do it, I know I get into fibrillation issues. So that must up the, is it hypertension that your alcohol and coffee stimulates?
That can, yes. So caffeine is a stimulant, so that will raise your heart rate and blood pressure accordingly. So the issue with, why is hypertension, why is a high blood pressure a problem? Well, the answer I usually give to my patients is, if you think about those, circus clowns or the magicians who take those big rubber balloons and make animals out of them. If you had to take one of those or a similar kind of balloon and weaken that wall before you blow it up, well, obviously it's not going to blow up uniform. It's going to bubble out in that weak spot. So a high blood pressure is going to have effects on the smallest vessels in your body or the weak ones. And the three big ones, or the three big organs that we worry about, number one, your eyes, because the blood vessels of your retina are very fine. So sustained high blood pressure can cause retinal problems and decreased vision and lead to,
wow, I didn't realize that. That is interesting.
The second one is your kidneys. And this is probably more of it, dangerous is the right way, but it can lead to kidney failure, because the kidneys are special. Again, if you go back to high school biology, you have big veins that separate to little veins and then capillaries. The kidney obviously separates out into capillaries, the glomerulus, where at that point, fluid and waste are being filtered out into the kidney, but then it coalesces again, forms another vein. So it's actually a capillary first and then another vein and then capillaries again later. It is incredibly susceptible to damage. So a whole bunch of other things that can cause kidney failure, but hypertension, if it causes damage at that filtration site, then your kidneys aren't going to be doing what they need to do. You'll have accumulation of waste products in your body, and that can be fatal too if that allows or is allowed to progress. And the problem with all of these things is, by the time they're noticed, it's too late. You cannot reverse that damage and go back to a normal state of being. So the annual checks are important. And then from another perspective, the other organ that is obviously greatly affected by this is your heart itself. I mean, your heart's a muscle. So if it's constantly having to force blood out at a massive pressure or against a high pressure, eventually it decides, well, look, I'm not strong enough to do this. And hey, that kind of thing on your biceps, great, but not so much for the heart. So as the heart expands and gets bigger, it starts changing its own sort of structure, pulling valves on the inside apart so that they're not shutting off as they should.
Oh, right. Yeah.
That leads to weakening outflow. The heart needs to do more, and eventually heart failure and other problems. So it's a very, very common health problem, but one that is so overlooked, and it's often just left. If you're not getting checked regularly, it's something that can creep up on you pretty quickly.
All right, Dr. Rory, thank you very much. And I look forward to chatting with you next week. We're going to have some more interesting factors and information from the doctor.
Thanks, my friend. It's nice chatting to you, bud.